Welcome to Whitman Partners Perioperative Powerless Series for 2022. Today we have Jeff Hawkins, who is the VP of Clinical Services for Cox Health in Springfield, Missouri. Jeff, thank you so much for taking the time out to talk with us. I know you're super busy, and so I really appreciate you giving us this time.
Well, thank you for having me.
You're welcome. You're welcome. So the first question is, what event happened or opportunity happened in your career that sent you off to the trajectory of executive leadership?
I ended up here by accident, I'm convinced. My career has been multifaceted. I am not a traditional college student. I did not complete my first college class till I was 30 years old. So for me to end up in an executive chair was very unlikely. I worked as a meat cutter for 14 years. So I like to joke that we have a butcher running surgery, so sorry, bad joke. But I did that for 14 years. I've been blessed in that I've always loved what I have done. Many things came through that I won't bore you with, but had an opportunity to get into healthcare. Did that. My wife is a nurse by background. She inspired me, she says. Who am I to argue? And got into healthcare, and it has been incredible. And found myself working in perioperative services after many other opportunities. Actually came to perioperative services as a Six Sigma black belt, doing performance improvement projects within the ORs. And one day was asked to become the director. I did that, served as administrative director for a healthcare system for about 5 years. Opportunity opened up here at Cox Health. They were looking for a vice president of perioperative services. Threw my hat in the ring, and I've been here since then.
Nice. And so part of your job, you manage multiple facilities, is that correct?
Yes, ma'am. We have 3 main locations that I'm directly responsible for here in Springfield, 3 surgical locations. And then across the system, there are 3 other locations that we help guide and direct.
Okay. And so what is your approach that works the best in your experience for streamlining initiatives across multiple sites? Because I'm assuming they probably have multiple needs. They're not all the same size.
They do.
Yeah.
And you're going to hear this from me again and again. It's communication and transparency. I'm a big person on relationships. I think it's important that people know you care. I think it's important that you're accessible. I think it's important that people feel like they can reach out to you. And we have built that on that. I'm very blessed. I have an administrative director for perioperative services by the name of Tina Lear. We'll give her a shout out. She has been incredible. Tina gets out and travels across the system. She meets regularly with the different managers from different locations. 3 of those managers report directly to her. 3 of them are more of a dotted line. But she does a great job with that. Our infection prevention team, we do that as a system. We look at those policies together. We work at those together. Even when our capital planning, we try to pull that together. We look at it together. We each have our individual boards at our locations, but yet there's a system governing board. But through that, we're able to look at it and prioritize and even do some bundling of, hey, if we're going to need anesthesia machines next year and you got some you're buying this year, let's just go ahead and get them all together and try to get a better price on them. A lot of initiatives like that we have done. I think the important thing is that everybody's voice is heard, and that we all understand we have different needs. So.
We've been hearing a lot about the Great Resignation, the last several months throughout multiple industries, and healthcare hasn't been, immune to that. What are some strategies to help deal with staff shortages, which has been a problem anyway before COVID, and then also just addressing burnout? Like how has that affected your facility and your organization?
So I am guilty of being old in thought sometimes, but I am changing. I am growing. I'm, 5 years ago, I was very much so the individual that no, the most important thing about work is being here and being available and showing up on time and making sure that you're there. The ideal of working remotely was foreign to me. I thought, boy, that's just people looking for a way to goof off. Um, I have changed my heart. I have been open to that. We are actually now encouraging people to work remotely. Many of our quality people, our billing people, our scheduling people, they can work from anywhere. They don't need to come into the hospital, and we have accommodated many of those requests. The other thing that we're finding is that our new generation of workers are very different from my generation. Their needs, their desires are different. I was the person that was going through your timesheets, circling if you were 2 minutes late, and all those things. That was me. I have learned that we got to be a little more flexible in that. Hey, if your shift starts at 6:30 because of daycare, you can't get here till 7:15. Let's figure out how to cover that 45 minutes. Maybe I got somebody from the night shift who's willing to stay over. Maybe I got a supervisor who could work that into her schedule. Of course, the problem is you can't do for one without doing for all. So you always have to be careful of favoritism, equity. But we've really had to get creative. No longer is it that you clock in at this time, you leave at this time. Um, you've really got to be creative and work with people. And honestly, my family's full of healthcare workers. I think I mentioned before, my wife is a nurse. Two of my children are nurses, and I got another child who's a clinic manager. Um, and while I'm a little bit removed from all that, they're all frontline people, and I can see the pain in their eyes of what they've been through. And as I round in my departments, I'm a big person about walking around. You go out where the work is. I can see that same pained look in others' eyes. And uh, sometimes just a pat on the back. Are you okay? Anything I need for you? And if you see someone who is just really struggling, if we need to get them out here for a few days, let's get them out of here for a few days. I'd rather not have an employee for a few days than run the risk of losing them altogether. We all just need that mental health break, we'll call it, where maybe we just need some time away. And we need to be flexible enough to be able to grant that. Now, that gets very creative when you're trying to run a surgical block and trying to keep surgeons happy. Um, but again, I've been blessed here with a great group of physician leaders who kind of understand. They kind of get it. As a matter of fact, my medical director, Dr. Randy Mullins, he will meet with individual groups. He's done books. He's done a book club with them. He's done different things, just trying to show them that they're valued and that they're important to us and that we can't get by without them. And again, people are people before they're coworkers, and I think we all need to remember that. We've all got situations. There's things going on in my personal life that they're not aware of, and there's things going on in their personal lives that I'm not aware of. So we just have to extend each other a lot of grace, a lot of patience, a lot of understanding. And part of my job as a leader is helping my surgeons, anesthesiologists, other leadership members to understand that.
Yeah, that leads into my next question about, how do you attract workers? How do you retain workers? And it sounds like some of what you said applies to that.
It does.
Yeah, and the demand for travel nursing has exploded as well.
Yeah.
How has that impacted your organization, the travel nurse demand?
The travel nurse demand has crippled us in multiple ways. Number one is staff leaving to travel. You know, I'm confident that everybody who sees this has experienced that same thing. You've kind of got that handful of people that are um, deathly loyal to you and are great employees. And when you have one of them come into your office and say, "Hey, I'm going to go sign a traveling contract," um, we found that the best thing I think to do is to be supportive, encourage them. I understand the money's ridiculous. I can't tell you not to go earn $200,000 next year. I can't tell you not to do that. Um, but when you get tired and when you're ready to come home, please come home. We want you back. Um, and that's a big piece of that. The other part of that is, and I think we've gotten past that part. But when we first started bringing travelers in, there was that disconnect between our staff and the travelers, and a source of resentment. Well, you're paying that person all this money, and you're only paying me this, and trying to convince staff, well, we were bringing them in to make your life work easier. Without them here, it would make it more complicated. Unfortunately, the end result has just been continued people leaving to go seek that that same that same thrill of the large paycheck and getting to travel some. But we're already, as an organization, starting to see one or two people coming back from their hiatus. So we're glad to see that. Obviously, financially, it has been crippling. Without some of the federal government coming back into our health system, we would be in real trouble. We know that can go on forever. So we are desperately working on trying to right size everything we can. We have to be smart with our spend. So much of it is going to labor now as a system. I want to brag on our board here. They have invested, it's just over $50 million in unbudgeted pay increases into our staff as a system. And that's uncalled for, particularly when you look at your operations and you're running in the red. Um, it's hard to convince people that we need to put more money into it rather than, oh, we got to get leaner, we got to get leaner. Throughout the pandemic, Cox Health did not lay off a single employee. No one missed a paycheck. No one missed an hour of work. Everybody found work. It might be doing something non-traditional. I got one individual. He's one of our uh, um, first assist scrubs, and he went down and worked on the loading dock. He's a big guy, big muscular guy, strong as an ox, and I'd bump into him around the hospital pulling pallets of supply, and just as happy as a lark. And as we started getting our surgeries going back, I remember going down and talking to our logistics guys that, hey, I'm going to need to pull Dave back, and they were not happy with me because they loved him. But boy, I was glad to get him back in the ORs. But if anybody was willing to work, it might be a non-traditional job, but you were paid your normal salary. You received every hour that you were scheduled to work. It might be working as a PPE observer. It might be working, helping doing turns. It might, all those things that we've done. Um, so I'm really proud of that. I think that went a long ways with a lot of our people to remain loyal to us and to stay. But yet, like I say, we've had our fair share of people wanting to go out and do the traveler gig as well. Um, I think another thing happens again is that communication, transparency again. Big believer in walking rounds. I think I have about 51 cost centers that report to me. It is my goal to be in each and every one of those cost centers, at least try to get it once a month, but at least once a quarter. Even our outlying community hospitals, we have a hospital in Lamar, Missouri, which is about 90 miles from here. I will make a quarterly trip out of there just to touch base. I know I've had people tell me, well, that seems like a horrible waste of time and inefficient. Hey, if I can go out and just look that site manager in the eye and talk to a few of their people and visit with the hospital president out there and make sure that we're meeting our stakeholders' needs, um, that's time well invested. Um, so we will hit all our community hospitals at least quarterly. Um, but I think that's important. Again, it's having a face. I'm a big believer that as an executive, my job is just simply to make my people successful. Easy job, right? All I got to do is make other people successful. And if that is going out and meeting with them, sitting down to talk with them, um, we will have. I'm rambling here, so you can stop me anytime you would like. But
You're good.
I feel pretty passionate about this stuff. Again, Tina will go out. She does walking rounds. Sometimes we'll schedule walking rounds together where the two of us are going to the different perioperative departments and we're stopping and we're checking on people. I think it's important that they see administration and their leader are hand in hand on this. I do open forum meetings every month. I'm in at least one department meeting with frontline staff. Um, I I set them up for an hour. I spend the first 20 or 30 minutes kind of going over things that are happening within the system that I think they might find interesting, financials as well. I think it's important they know where we're at financially. But more important than that, then we spend that last portion of that just letting them to ask me any question they'd like, anything about what I talked about what I didn't talk about. Are there rumors out there? Are there things I can address? And by all means, I don't have all the answers, and that's the manager's job of that department. They jot down the question. If I don't have the answer, they send it to me, and then my commitment is I will get that answer, get it back to that manager within 24 hours to distribute amongst their people. So that's just a few of the things we're doing. I don't know that I've got a magic pill because obviously we're still struggling, but I just think that there's no more important initiative right now than what we could have asked other than in our people.
Yeah, I feel like you answered my next question because it's about like your how has the pandemic changed your leadership style? And you mentioned about you changed your views about remote work and some of the stuff you're talking about. Is there anything you want to add that depend how it has impacted how you lead?
I think the other thing is being empathetic. Uh, so many people they come to work and I don't know that our community is unique, but we're in the Ozarks here in Missouri. The community that we serve, the Springfield metro area, is about 450,000 people. So it's not backwoodish, but we do serve a rural area to that as well. Um, and we have, uh, the public does not appreciate what our healthcare industry has been through, what our healthcare workers have seen, have done. Um, Social media comes from Satan, I think. There's horrible things posted out there. There's terrible messages out there. It's just trying to keep that staff encouraged and let them know. There's a gentleman who, sorry, I cannot come up with his name off the top of my head, Mr. Cartwright. I'll call him that. He gave us a quote once that said, what people want is to be respected, and respect equals love. They want to know that you love them. And I think it's important that we show that we do care. Another thing that I have done is I'm a note writer. And if you saw my penmanship, you'd wonder why. But I think it is so important. I've had years where I've written over 400 handwritten notes, just a sentence or two, just telling people that, hey, all my leaders are required to report up positive actions to me every month. Then I take that list, and usually I do it on Fridays. I saw somebody else write some thank you notes on Fridays, so I thought that was a good time to do it. So I sit down on Fridays and I write my thank you notes. And we've got a choice rewards program here where we can hand out these little Cox Health points where they can exchange it for merchandise. And theoretically, if you could ever save enough of them, I guess you could buy a new washer and dryer with them. But if nothing else, you can get restaurant gift cards, things like that with them, and I'll drop those in there. But when somebody does something extraordinary, goes above and beyond, they deserve to be recognized. They need to be recognized. So many times we see people do those things and we just kind of say, oh, well, that was nice. No, take time to say thank you. And I think if you say thank you for the little things, it encourages that person to keep doing them. Now, the truth of the matter is, there's just people, that's what they do. But it's just important that we figure out a way to give everybody a pat on the back, however we can, when we can. Everybody needs that.
Yeah. When you were talking, I was thinking about some of the tips you were giving about leading and boosting morale, and trying to just support people. Like, what would you tell somebody, and like if you were a mentor, and actually, have you mentored anyone?
Oh, I do quite a bit of mentoring.
Great.
Yeah.
Yeah. So like what would you tell someone now who is moving up into leadership and maybe at some point they might have your job? Like what kind of advice would you give them?
My first advice is that, particularly in my role, physician relationships are crucial. You know, we talked earlier about relationships, but those relationships are crucial. Um, Anytime a physician comes to you with a problem, no different than an employee, first they just want to be heard. You know, they want to be heard. I had one of those interesting phone calls from Wednesday from one of our more spirited surgeons. And after about 10 minutes, he kind of caught his breath and talked a little bit. And at the end, he says, Jeff, thank you for listening. Um, Meant a lot for him to say that to me, you know. But many times that's just what it is. People need to be heard. And if they need to get something off their chest, I'd rather they do it to me than what they would in the OR. So we've kind of, with several of our surgeons, a few of our surgeons, I should say, we've kind of built that relationship over the past 9 years that, hey, if you ever just need to talk, if you're upset about something, call me. Um, I think transparency, again, is one of those important things. My cell phone number is posted in our Outlook address book. Um, there's not a person who couldn't go out there and find my cell phone number and call me here within the hospital. And I encourage people to do that. Hey, if you ever need me, I'm here. I know you got a manager. I know you got a director. I know you got a supervisor, but please know that I'm here. I've had a few people take me up on that. I've never had anybody abuse it. Um, um, and I think it's just important, again, to be available, to be transparent, to communicate. I think it's important to be seen. It's one thing to say you got an open door policy. Who's going to trot their butt up to administration and walk into administration and come in through the door? Nobody. When I was a staff nurse, I stayed as far away from that place as I could, you know. Um, but if I'm in your unit and I'm walking through the PACU and I'm making rounds and I'm coming up and I ask you, you know, how's your day going? How's everything with you? How's your family? Is there anything I can do for you? Is there something we ought to change? Is there something we can do better? That's what an open door policy is. Again, is when you get out amongst the people. Um, you can't lead from your office. You got to get out where the work is done. Um, I'm a big believer that every day you got to spend time out in your departments every single day. I actually scheduled on my calendar, and my
Is
assistant helps
is
me.
um is that something that's not common, you think, in terms of putting yourself out there? And what's the temperature on that?
I'm hoping it's more common now than what it used to be. In a previous life, about 20 years ago, I was the director of rehab, and we had hired an external consultant to come in and help with patient experience in the facility I worked at that time. And she came in and was able to call a couple of my nurses by name. Well, this one time, my vice president happened to come down with her, and he had to introduce himself to the staff. Um, that kind of one of those lessons, you know, you learn something from everybody. It's like, okay, if I ever get there, that will never happen to me. And I try to live by that. So here at Cox Health, we've got people they do round in the departments and all. It's an expectation, but I'd be doing it regardless. I hope that happens across all health systems, but I can only speak to my two experiences. One with our competitor, again, to be fair, that was 20 years ago, and what we do here today.
Yeah, yeah. Final question. How do you prioritize resources across your facilities, especially, during COVID, where it's very unpredictable when surges are going to happen, at what places, how bad hospitalizations get. How do you prioritize the needs of these
So,
different facilities?
two-part answer. As far as the COVID piece of it, we actually had a system-wide incident command. Um, at there for a while, we were meeting every Tuesday and Thursday. Again, via technology, it's a wonderful tool. You can bring everybody into the meeting room. And we would go over those needs and where we were doing. And we did so many different things. There for a while, we tried to centralize all the COVID patients into our mothership here in Springfield. Um, Soon that was saturated and we couldn't do it anymore. So then we started figuring out what support we could provide to our community hospitals in order for them to keep them there and provide care there. Um, and we've gone back and forth on different things depending on resources available and what we could do and what the need was. So on the COVID approach, at least, that was very much so controlled by the incident command. If we're talking about peri-op world, again, I'm going to give a shout out to Tina. Um, and she is so good about pulling everybody around the table and communicating it. I mentioned earlier about looking at capital needs and really trying to be smart about that and trying to think through all that. So I think that's that prioritization piece. The other thing that we have done, and we did this pre-pandemic, and it's been a lifesaver. It saved our bacon more than once. We developed a perioperative float pool. And within that, we have three different positions. We have in the OR, we've got RNs and surgical technicians. And then outside, we've got PACU, and then we got pre and post nurses. And that has been just so crucial. I've got a manager, a supervisor that oversees that. She will place those people where the greatest need is. Here in Springfield, we do have three campuses. So literally, you might start in the morning at 1, and then in the afternoon, they say, hey, go take lunch. Then after that, why don't you drive over to the other facility and help them finish up? And that team does that. They have been fantastic. That's really been a lifesaver for us. So we just got to figure out how we can share resources, how we can get smarter at whatever we're doing.
Great. Well, that concludes our interview, and I am so happy to have you here. One of the things I love that you said was that you changed your mind about remote work, or not because of remote work, but just the fact that you changed your mind about something that you had dug your heels in about. I think that's incredible and amazing.
We've got to change, we've got to change as individuals. We've got to change as an industry. And I think they call that growth. It can be painful, but you can get there. Yeah.
It is painful. It's supposed to be. And then the pain goes away.
Yes. Yeah.
Awesome. Well, thanks again, and you have an excellent day.
Well, thank you for having me. Appreciate it.
You're welcome. Bye-bye.